What is depression? Depression, also known as major depressive disorder, is a mood disorder that makes you feel constant sadness or lack of interest in life. Most people feel sad or depressed at times. It's a normal reaction to loss or life's challenges. But when intense sadness, including feeling helpless, hopeless, and worthless, lasts for many days to weeks and keeps you from living your life, it may be something more than sadness. Because of its complexity, a full understanding of depression has been elusive. There is mounting evidence that depression may actually be a necessary defense strategy of the body, a kind of shutdown or immobilization in response to danger or defeat that is actually meant to preserve your energy and help you survive. Depression affects more than 264 million people worldwide, affecting not only their thoughts and feelings but also their behavior. What causes depression? Researchers don't know the exact cause of depression. They think that several factors contribute to its development, including brain chemistry, an imbalance of neurotransmitters, including serotonin and dopamine, contributes to the development of depression. Genetics, if you have a first-degree relative, biological parent or sibling with depression, you're about 3 times as likely to develop the condition as the general population. However, you can have depression without a family history of it. Stressful life events, difficult experiences, such as the death of a loved one, trauma, divorce, isolation, and lack of support, can trigger depression. Medical conditions, chronic pain and chronic conditions like diabetes can lead to depression. Medication, some medications can cause depression as a side effect. Substance use, including alcohol, can also cause depression or make it worse. Factors that are likely to play a role. Genetic features. Changes in the brain's neurotransmitter levels. Environmental factors such as exposure to trauma or lack of social support. Psychological and social factors. Additional conditions, such as bipolar disorder. Interactions between various factors can increase the risk of depression. For instance, a person with a family history or a genetic risk of depression may experience symptoms of depression following a traumatic event. The symptoms of depression can include feelings of sadness, tearfulness, emptiness, or hopelessness. Angry outbursts, irritability, or frustration, even over small matters. Loss of interest or pleasure in hobbies or activities. Sleep disturbances, including insomnia or sleeping too much. Tiredness and lack of energy, so even small tasks take extra effort. Reduced appetite and weight loss or increased cravings for food and weight gain. Anxiety, agitation, or restlessness. Slowed thinking, speaking, or body movements. Feelings of worthlessness or guilt, fixating on past failures or self-blame. Trouble thinking, concentrating, making decisions, and remembering things. Frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide. Unexplained physical problems, such as back pain or headaches. What are the types of depression? Persistent depressive disorder refers to when a low mood lasts for 2 or more years in adults and at least 1 year in children and adolescents. A person with this disorder may experience episodes of major depressive disorder along with periods of less severe symptoms where they are typically able to function day to day. Postpartum depression affects women after having a baby. It causes intense, long-lasting feelings of anxiety, sadness, and fatigue, making it difficult for mothers to care for themselves and/or their babies, as well as handle daily responsibilities. Postpartum depression can start anywhere from weeks to months after childbirth. Psychotic depression is a form of depression with psychosis that comes when people get very depressed, such as delusions, false beliefs, and/or hallucinations, hearing or seeing things that are not there. Seasonal affective disorder is associated with changes in seasons. This form of depression usually occurs during the fall and winter months when there is less sunlight. Bipolar disorder is different than depression, but a person diagnosed with bipolar disorder can experience episodes of major depression. Does depression look the same in everyone? Depression can affect people differently, depending on their age. Children with depression may be anxious, cranky, pretend to be sick, refuse to go to school, cling to a parent, or worry that a parent may die. Older children and teens with depression may get into trouble at school, sulk, be easily frustrated, feel restless, or have low self-esteem. They also may have other disorders, such as anxiety and eating disorders, attention deficit hyperactivity disorder, or substance use disorder. Older children and teens are more likely to experience excessive sleepiness, called hypersomnia, and increased appetite, called hyperphagia. In adolescence, females begin to experience depression more often than males, likely due to the biological, life cycle, and hormonal factors unique to women. Younger adults with depression are more likely to be irritable, complain of weight gain and hypersomnia, and have a negative view of life and the future. They often have other disorders, such as generalized anxiety disorder, social phobia, panic disorder, and substance use disorders. Middle-aged adults with depression may have more depressive episodes, decreased libido, middle-of-the-night insomnia, or early morning awakening. They also may more frequently report having gastrointestinal symptoms such as diarrhea or constipation. Older adults with depression commonly experience sadness or grief or may have other less obvious symptoms. They may report a lack of emotions rather than a depressed mood. Older adults also are more likely to have other medical conditions or pain that may cause or contribute to depression. In severe cases, memory and thinking problems, called pseudodementia, may be prominent. How is depression treated? Depression is one of the most treatable mental health conditions. Approximately 80% to 90% of people with depression who seek treatment eventually respond well to treatment. Treatment options include psychotherapy. Talk therapy involves talking with a mental health professional. Your therapist helps you identify and change unhealthy emotions, thoughts, and behaviors. There are many types of psychotherapy. Cognitive behavioral therapy, CBT, is the most common. Sometimes, brief therapy is all you need. Other people continue therapy for several months or years. Medication, prescription medicine called antidepressants can help change the brain chemistry that causes depression. There are several different types of antidepressants, and it may take time to figure out the one that's best for you. Some antidepressants have side effects, which often improve with time. If they don't, talk to your healthcare provider. A different medication may work better for you. Complementary medicine. This involves treatments you may receive along with traditional Western medicine. People with mild depression or ongoing symptoms can improve their well-being with therapies such as acupuncture, massage, hypnosis, and biofeedback. Brain stimulation therapy. Brain stimulation therapy can help people who have severe depression or depression with psychosis. Types of brain stimulation therapy include electroconvulsive therapy, ECT, transcranial magnetic stimulation, TMS, and vagus nerve stimulation, VNS. There are also things you can do at home to help improve depression symptoms, including getting regular exercise, getting quality sleep, not too little or too much, eating a healthy diet, avoiding alcohol, which is a depressant, spending time with people you care about.